Hi everybody, welcome back to the YouTube channel. Today I have a very kind of long video for you, but it's very informative if you are interested in what I'm going to be talking about. So before I get into my whole dental implant experience, if you haven't subscribed already, go ahead and hit that subscribe button. Go ahead and hit the like button on this video, and if you are already a subscriber and you are here returning, thanks for come and see me again. So let's get right into the video. Today I'm going to be talking about my dental implant experience. I know you guys probably thought it was like ass or titty implant, but it's not. It's a tooth implant. This happened about 2 years ago, to be exact. Actually, it was like October, and this was something I wasn't really going to share with the internet just because it was like kind of personal. It was just like a personal situation I was like having to get done, and I didn't think it would be like that big of a deal to actually like share with the internet. But then like I kind of thought about it, and I was like, I might as well just share my experience, just because when I found out I had to get this surgery, I went to YouTube, just like I go to YouTube for everything else, and I tried to look up like other people's dental implant experiences, and it wasn't that many, honestly. The only videos that I kept running into were like videos of like dentists like already talking, like telling you like what a dental implant is, but there was like no one actually real just talking about their experience. So I thought, let me just get on YouTube and tell everybody about my experience, because I'm sure, I mean, if you are on this video, you most likely are interested in, or you have to get this procedure done, and you just kind of want to know more about it and like how other people feel about it, you know? Because that's what I wanted when I was going into it. So let's just backtrack to why I even had to get this surgery. So let's go back to like a lot of years ago when I was very young, probably like around 7 or 8. I had trauma to my, I'm sorry, let me tell you what tooth it is exactly. So it is this tooth in the front. So years ago when I was a kid, basically I had trauma to my mouth, and I just remember like I had a cousin, and I used to always go over her house, and she had a bunk bed, and her bunk bed was like made of steel. And I remember like it had like these long like poles on the side, and like as a kid I would always like play on them, go halfway up and like spin down on them and shit. I don't know, like, you know, like some stupid kid shit. And I remember one day I kind of lost my balance, and like my arm slipped and my mouth hit the side of her steel bunk bed pole, and it fucking hurt like shit. And I remember like I also busted my lip right here, and like you can kind of still see the scar. Like if I don't have makeup on, you can kind of see it. So that happened, and at the time I didn't think much of it, and like I didn't really have like issues like besides like the cut on my mouth and everything. But you know, like now that I'm older and I kind of look back at it, I feel like that could potentially have been like where my tooth fucked up pretty much. So as I kind of got older, that like this side tooth, it was chipped. It was like smaller than the rest of my teeth, and it just wasn't like, you can just tell it was trauma to the tooth. So I did end up going to the dentist, and my dentist ended up like giving me an x-ray and everything, and he ended up telling me that I had to get a cap over, because basically the tooth was like, the tooth was damaged. So what he did was he filed my tooth down, and then he ended up putting a cap over it. Now a cap is kind of like a veneer, except with veneers they usually don't shave your teeth down. I know some dentists do, but that's usually a procedure when you are getting a cap. So my dentist ended up shaving my tooth down, the tooth that already had damage, and he put a cap over it. This dentist that I was going to, he kind of wasn't that like good of a dentist. He didn't really like vocalize like what was actually happening or like what I would have to deal with in the future getting that cap. So he ended up putting the cap on, and I remember when I got the cap, like I didn't really like it. I mean, I guess it was better than like my real tooth, but also like it kind of wasn't any better. Like it was really ugly. It was like kind of big, and it was like super white, and it just didn't look good. So I ended up having that cap for a few years. I ended up just like being like living with it. Obviously, like I was kind of insecure about it, but it wasn't like that big of a deal. So fast forward, throughout the years I did live with like this cap that I was kind of insecure about. And what my dentist didn't tell me is that caps do not last forever. And along with veneers, which if many of you do know, like veneers don't last forever either. It is like a cap situation. It lasts like 10 to 15 years, and then you do have to go back and like get it redone. My dentist didn't tell me that, and my dentist also went out of business. I'm not sure why, but like he was trash, so who knows. So yeah, so fast forward to like 2 years ago pretty much. I was just like living with the cap, right? I always knew that I wanted to like get it fixed, but it was never anything that was like urgent. So one day I'm like eating, and I remember eating, and I remember my tooth kind of feeling wiggly when I was eating, and I was like, what the fuck? Because, you know, like I am in my 20s, so I'm thinking like, what, like why the fuck is my tooth wiggling? You know, like in your 20s, if you have a wiggling tooth, that's kind of like a bad sign. So I ended up like realizing that the cap that I had over like these past years, it was like loose. And so like I ended up panicking and everything, because it's like it's also in the front of my mouth. So it's like if this tooth falls out, or like if the cap falls off, like it's literally in the front of my mouth, and I'm just gonna be stuck here with like a needle tooth. So I ended up scheduling an appointment at a local dentist, a new dentist, not the guy that gave me the cap, because he is shut down. So I go there, and she gives me an x-ray and everything, and she basically tells me that my tooth, like my real tooth underneath the cap, it broke. I'm not sure how. I'm not sure like why that happened, but it did. And also it was kind of, the cap was around like 10 or 11 years old already. So it kind of was already that time where like your cap or your veneer needs to be replaced anyway. So, I mean, I'm going into this dentist thinking like, okay, the cap needs to be replaced. It is about like 10 years now since I've had it, and like I'm gonna just go get it looked at, get it replaced. But then like she told me that my real tooth was broke underneath it. So at that point we kind of had a bigger problem on our hands, because in order to actually get a cap, it has to have a post. It has to like have something to stick on. And because my tooth was broke underneath, like it no longer had anything to stick on. So she kind of goes over like the options with me. Like basically there was no option besides getting an implant, and at the time I didn't really know what the fucking implant was. I never really looked into it because it wasn't anything that I needed, you know. So she goes over like all this stuff, and like she was kind of a trash dentist too. She didn't really help me out that much. She did give me like information on what an implant is, and she did tell me how much it costs, which I'm gonna go over with you guys because it is pretty fucking expensive too. And she ended up giving me like a reference of dentists who specialize in dental implants, because of course she didn't. So she did end up giving me like references of like other doctors or like dentists I can call to like get the procedure done. And she also said that I needed to get it done quickly, because like the cap would all the way fall off at some point, and then I would be fucked with no tooth. So basically with the implant, you will get your real tooth extracted. So basically like they will take your tooth out, and then there's a screw that they screw into your gums, and on the screw they put on like artificial tooth, which is like, the tooth is super realistic. Like it looks like, well, depending on like what dentist you go to, it looks pretty fucking real, you know. Definitely better than a cap. And with the implants, they last like forever pretty much. Like they're pretty permanent. You can't just like take it out when you want to, and for the most part you can pretty much like bite through anything. Like they're pretty durable. After she like went over the implants, the implant procedure and everything, she went over pricing for an implant. Because I got one implant that ran me, I don't know if it varies by dentist, but it usually runs you between $3,000 to $5,000, and that's just for one fucking tooth, guys. Like literally one tooth. I do know if you get multiple implants, they can give you like a deal, but I only needed one. That was like the price range for one implant. So after I like got the news about all that, I was pretty fucking bummed out, because it's like, where the fuck? Oh, and I forgot to tell you guys, with that price, your insurance does not cover it. So I did have insurance, but implants are considered a cosmetic surgery. I'm not sure why, because I mean, I guess I understand why, but it's like in my case, like it was an emergency, you know? I wasn't doing it to be cute or anything. But your insurance does not cover dental implants. It is a cosmetic surgery, so you will have to either come out of pocket or finance. They do have this thing called Care Credit, and it's basically a credit card for medical. You can use it for like dental, you can use it for doctors, you can use it for like BBLs, or you know, whatever you want to use it for medically. With Care Credit, depending on like the dentist you have, you can go over like financial situations and like set a plan that will suit you and like your budget and everything. So after I got like all this information, I was pretty fucking like overwhelmed, because it's like, where the hell am I gonna get like $3,000 to $5,000 for an implant? Mind you, like this tooth is an emergency. Like I need it now. I can't just walk around with like my cap like this. So I did end up like doing my own research for dentists, just because like the dentist that she gave me, I did research and they didn't seem that legit. With like work wise, when I looked at their work, it didn't really seem like, I don't know, like nobody stood out. So I did end up doing my own research, and I ended up finding a really good dentist that was in my area at the time, in the Bay Area. So I did end up going to a consultation, and at the consultation, that was free, and there I ended up getting like a lot more information on like the implant and everything. And the dentist this first dentist that I got the consultation for was actually the dentist I ended up going with, because he actually seemed really legit. It's like a family owned dentist, and like they were pretty cool, and I went over like his like work, and like everything looked good. I like looked at the reviews and everything, and like everybody was like in love with their work. So I decided to go with that dentist. I did end up getting a Care Credit situation, just because I didn't want to like just put all that money on the line like right away. And my implant exactly cost $3,400. So I did end up getting Care Credit, and I ended up getting a 2-year plan, which I pretty much just finished, which I'm pretty fucking excited about, because that's like one less bill that I have to worry about. At the consultation, once I told him like I wanted to do the Care Credit situation, everything, I basically went home, signed up for Care Credit, got approved like pretty fast, because I have pretty good credit. And then I ended up visiting the dentist again about a week later, and that is where I ended up giving him my payment, and I also ended up getting my getting impressions. And then at the same appointment, I had to get my tooth extracted. So what I will tell you is that this procedure does take about a year in total to finish. It's not something that is fast, just because in the process there's going to be a lot of healing that you have to do. So the actual process is fast and it's pretty simple, but because your mouth has to heal a lot, you have to have a lot of like time, a lot of downtime when it comes to like going and getting your screw in and everything. So the first appointment was me getting my tooth extracted. At the first appointment, I didn't really know what to expect. On YouTube, I seen some videos where like dentists were saying that they put you under like laughing gas, or like they put you to sleep. Basically asked my dentist like what was the procedure for that, like are you gonna put me to sleep, like what's happening. And I kind of wanted to be put to sleep, just because I didn't really want to like see, or like I didn't want to experience anything. I wanted to just like wake up and shit be done. But my dentist did tell me that he was not gonna put me to sleep. We ended up doing local anesthesia, which is basically like your regular shot to numb your mouth when you like get fills or like a tooth extraction or anything like that. So he did tell me that I was gonna get local, which I kind of appreciated after, just because like in order to get put to sleep, that would have been like another $400. So I did end up getting local, and it actually wasn't that bad. So the first procedure, when I did get my tooth extracted, I ended up just like wearing earphones, and like I listened to a podcast the whole time, because I didn't like want to like see anything. Like I kept my eyes closed the entire time. I'm like such a baby when it comes to the dentist. So I got my tooth extracted, and it actually wasn't like that bad. It was actually pretty fast. I feel like he like yanked it out in like 3 seconds. So I got that. He did end up doing a bone graft. So basically a bone graft is like, there's your tooth, and then like there's the bone in your gums, and basically like if you have okay bone, like strong bones in your gums, you don't need to get the bone graft. Most people getting implants do need this, because if the tooth is already like damaged to the point where you need an implant, you like your bone is most likely damaged too. So I did end up getting a bone graft, and basically they put like artificial bone or cadaver bone in your gums. And that's what I had to get, just because like I already said my tooth had trauma to it, so I'm pretty sure like the whole area was damaged. So he did bone graft, and then he ended up sewing my gums back up. So from there I had to go home and basically like heal for about 4 months. So I did end up getting a temporary tooth. So when he did my impressions, they were able to like get a temporary tooth made for me. So once he took my actual tooth out, the same day he gave me my temporary tooth. The temporary tooth, you have the option of either getting a tray, like kind of like a Invisalign, which has like the temporary tooth sitting in it, so you can put the tray in and basically it'll look like you're wearing Invisalign, but it really is like your tooth. And the other option was to get like a thing that is kind of like a what is it called, a retainer, and then it has the tooth on it. So there is no tray, it's just a retainer, and you like put it in and your tooth is there. So I did end up going with the retainer option, just because I didn't want a whole like clear tray on my teeth the whole like for a year pretty much. So I did end up getting the retainer temporary tooth, which like it can come in and out, and it was very convenient. And I mean, obviously the tray, like the Invisalign tray one, can come in and out as well. I believe that like with the temporary tooth, it is like best that is a situation where you can take it in and out, just because like when you are at home, it's best to like let it just chill and like let the temporary tooth be out, even though it's like kind of like embarrassing to see yourself like with a missing tooth. It is good to like let that area breathe and like not have that temporary tooth on it the whole entire time, just because like you want that area to heal nice. So I ended up getting sent home, and for 4 months I had to let that bone graft pretty much heal into my mouth. I had to let that bone get like strong enough to be able to hold the implant. So I did that for 4 months, and then I did end up going back to the dentist for a checkup. So in between your procedures, you're also gonna have like checkups, just so they could like see if they can even go forward with the next step. I don't even think it was 4 weeks. I think it was like 3 weeks. I went back for a checkup just so my doctor could see like how my how like the new bone was healing. So I did go in for a checkup, and this was pretty scary because my dentist did tell me that like after doing like x-rays and everything, that my bone, the bone that he put in, the bone graft, it wasn't healing 100%. So this is another advice that I have for you people, especially if you are anything like me and you don't like milk, like you don't drink milk at all, and you kind of lack calcium. That is what happened in my case. Since I don't drink milk, and since I did lack calcium, my bone wasn't healing like as fast as it should have been. So if my bone didn't heal correctly within the time frame that I needed to get my screw in, I would have to basically reverse everything, and like he would have to take everything out, and like we have to start from step 1 again. And that kind of bummed me out because I was kind of getting scared, and it was like, well, what the fuck do I do, you know? Like it's just like you can like get these procedures done and everything, and you can spend all this money, but it's like your body has a mind of its own. If it's like rejecting something, then like you can't really help that. The same with like breast implants, ass implants. Like if your body rejects that, then that's just what it is, and that's just money down the drain, you know? They don't give you a refund for this shit. So he did give me like a few, he did give me like some advice, like either like drink milk, which I was not gonna do, and then he also told me that I should take calcium vitamins. So that is what I did. Right after that appointment, actually, I like went to Target and I got some calcium vitamins because I wasn't fucking around. I was like, no, like the next time I see him, which was like another 2 weeks, like there had to have been some progress, because I wasn't about to just like throw this whole shit away or like start all over. I did go to Target and I got calcium vitamins, and I was taking them once a day, like every morning for 2 weeks. And then when I did go back to my checkup appointment, he did check, and luckily he said that like because of the calcium vitamins, like everything was fine, like it looked like my bone was healing like very well. So that's one thing that I will advise you to do if you are not really into milk, or like you don't get any like source of calcium. I would just start taking the calcium vitamins now, even before your surgery, or even before it gets to the point where your dentist tells you that like your gums or your bone isn't healing because of the calcium deficiency. I got that taken care of. And 2 weeks later, I went back to the office and he checked and he said that everything was good. So then he scheduled me an appointment to go ahead and get the screw in. I was nervous about the screw situation, because I just felt like throughout the whole procedure that probably was like the most painful part of it. And my dentist even told me, like a lot of people say that is the worst part of the implant. I did get my tooth extracted, the first step. It didn't hurt in the procedure, but when I did go home like later that day, anesthesia wore off in that spot. It did kind of hurt. It was like really sore and I couldn't really eat anything, and like you can't like drink anything hot, you can't eat anything hot, like you kind of have to really be careful. And I did get medicine prescribed to me, but the medicine was super fucking strong. It was like making me nauseous, and like it was just making me feel like a fucking zombie. So I didn't end up taking the medicine that the doctor prescribed me, just because it was like making me feel sick. I did end up just taking like Tylenol and Advil, and it was fine for me. I know everybody is different. If you have a high tolerance and everything, then you probably should take the medicine that your doctor is prescribing for this surgery. But in my case, I didn't really have to. Advil and Tylenol was fine for me. I did go back 2 weeks later, got my appointment to get my screw in. So for this visit, I was like super nervous. This was like the part that everybody hates pretty much. I will say that there was absolutely no pain during me getting my screw into my gums. It was really weird because I did like hear the drills. I could like feel the vibrations from the drills, and I will say that I also felt a lot of blood like gushing into my mouth, and like I could taste it too, and it was like, it was nasty. After it was done, it was like, it was fine. Like even once the medicine wore off, like hours after I left the dentist, I literally felt no pain at all. I didn't even have to take an Advil or Tylenol. I'm not sure if that was like that for everybody, but like it was weird that I didn't feel anything. When I went to my checkup after that, I actually talked to my dentist and I was like, is it normal that I didn't feel anything? Like I was kind of like getting worried, but he said that was normal. Like he was kind of laughing at me, and he was like, that's actually crazy that you didn't feel anything, because like a lot of patients say that was like the worst part or the most painful part, but like it wasn't for me at all. I would say that throughout the whole procedure, the most painful part was getting my tooth extracted, like after the medicine wore off, because it was sore and my mouth was super swollen. The day after, for like 2 days, like this side of my mouth was like super swollen, and like my lips were hella big and everything. But yeah, so I ended up getting the screw. And then obviously you have to go home and you have to let that heal for like another 4 weeks as well. So I let that heal. It was weird because like when you have the screw in, if you take your temporary tooth out and you like look up, you can see like your screw sitting there, and like I thought that was pretty fucking weird. Like it was the whole process was super weird, because it was like something that was so different, and like I never been through it before, so it was just weird like seeing me like that. My dentist checked and like everything was fine with the screw. So then after that, he places another screw at the bottom of that screw, and basically like that screw is called an abutment placement, and basically this is like the other part of the screw that will stick onto your actual like implant tooth. So once I went to my visit, and like he seen that like the screw inside my gums was like healed pretty nicely, he did end up putting the abutment in the screw inside my gums. And for the abutment, it does stick out a little bit. So what he did for my temporary tooth is he kind of like drilled it down a little bit in the inside so that I can still be able to wear my tooth without like it pressing up against, like without discomfort pretty much on. And then from there he ended up doing like another impression that he could send it away and then get my implant. Pretty much after your abutment is on, you're just in the process of getting your implant created, and that kind of takes some time because like this is a tooth that you're about to permanently have, so you kind of want it to be like the best it can be. Once we like sent my impressions to like the lab and everything, a couple of weeks later, my first implant did get sent to my dentist, and I went in to get it. And one thing I will say is that when you're on your last step of like getting your implant, I wouldn't really, you shouldn't expect the first implant to be like the implant, unless you are like, unless you get lucky and the first implant they put in is like literally perfect and exactly what you want, then like it will happen like that. But basically the first implant we ended up sizing and like putting in my mouth, it just wasn't right at all. Like it was kind of like bigger, it was like on the bigger side, and it kind of like stuck out a lot, and it was long. So it like everything about it was wrong. The thing about my dentist is that he was like super cool, and like basically like whatever I wasn't feeling about like the implant, he kind of wasn't either. Like we were on the same page about a lot of things regarding the implant, so that was pretty cool. That is one thing that I loved about my dentist, is that he was super laid back and cool, and he was very understanding. He wasn't one of those dentists that just like will throw anything in your mouth and be like, here, just to get it over with. Like we took our time going through implants, and I will say that I went through about 3 implants, like 3 different visits. Probably like a week and a half to 2 weeks later I came back, and then we had a second implant to put in to see if like it was the one, and that one wasn't either. It was still kind of too long, and it just like didn't look right, and the color was kind of off. And mind you, in the process of like me getting my implants, my dentist also advised me to whiten my teeth. So I think this is optional. You can whiten your teeth if you want to, just because when you get your implant, you want your teeth to be like as white and like as perfect as possible. So I mean, you can keep your regular color, but like I didn't want to. I wanted to whiten my teeth, so that's what I did. And then another thing I will let you know is that before implant, if you already have braces and your teeth are straight, then that's perfect. But if you aren't and you plan on getting braces like in the future, with implants don't move. So whatever way you're going to fix your teeth, you want to make sure that your implant gets put in accommodating that, because like I said, once you get your implants put in, whether you get braces or like Invisalign or whatever, that implant doesn't move. So my dentist did tell me, like he did go over that, and he did like ask me like, did I want to straighten my teeth like before my procedure and everything. But obviously I couldn't, because like it was an emergency procedure that wasn't even planned, you know, like my cap was about to fall off. So I didn't have time to straighten my teeth. So I did get them, I did get it in like with my natural teeth. I never had braces before too. I'm pretty sure you guys can tell. But yeah, so back to like the last implant. So we did end up like sending back like 3 implants before we ended up getting our 4th one, which was the one that I have. So this one was like it was perfect. It fit good. It was like the same color as my teeth and everything. Like it was perfect. So me and my dentist both agreed that like this was the one, and this is the one that we ended up going with. I didn't even show you guys the implant up close, but this is what it looks like. This one right here, and this was the perfect one for me. It fit good, it looked good, it looked really natural, and that's one thing that I liked about my dentist as well. He made sure that the tooth was really natural. He didn't give me one of those like big ass square like white teeth, like he made it like as natural as possible. So as far as like my implant, like I love it. I feel like this is the first time that like I'm actually confident about the work being done. You know, like I told you in the past when I got the cap, it was like it was better than my real tooth, but it was still something that I was kind of insecure about. Like it does feel good that I no longer have to be insecure about like my tooth anymore. The only thing I will say is that when my dentist did put this implant in, it does kind of stick out more than my other teeth, my natural teeth. Not a lot, like to the point where it's like, damn, like your tooth is hella sticking out. But I did have my dentist place it kind of forward. The dentist told me that my natural teeth are kind of set back a little bit more than like they should be. So he did let me know that like I can straighten my teeth in the future, but he just wanted to know if like he should sit the implant back with my natural teeth, or if he should bring it up a little bit for in the future if I do want to straighten my teeth. And I did tell him to sit it up a little bit just because in the future I do plan to like straighten my teeth. I knew if like if he set it back, I would like be stuck with my natural teeth, or even if I did get braces, then my implant would have been sitting back. So I think it's better for my future that like I had got it set kind of up, so that when I straighten my teeth, they'll all be even. And like I said, the implant isn't going to move, so even if I do straighten the rest of my teeth, the implant will still be in its spot. But yeah, like that was pretty much the whole procedure. I would definitely rate the experience a 10 out of 10, just because like I feel like because I went to a good dentist, you know, like everything was pretty easy for me. It was cool. The advice that I have for you if you are interested in getting this surgery done is that take your time when researching dentists. Look at their like past work and just pretty much know what you want. Like you have to be really vocal about what you want. If it's something you don't like, definitely don't be afraid to voice that. Like I said, I ended up getting like 3 implants sent back to the lab before I actually picked one, because I didn't like it. And like, you know, like I knew that it was a permanent situation. I knew that like if I didn't say anything, voice like how I really felt about the first 3 that weren't really right, it could have been bad. And also if my dentist was just like not good, they could have just put anything in my mouth and been like done, you know. So definitely make sure to research a very like good dentist that you can trust, and also make sure to be vocal about everything you like and dislike. If you don't like milk, if you aren't getting enough calcium, definitely take calcium vitamins, just so you won't run into the problem that I had when, you know, my bone graft not really coming through the first time. And overall, like, just don't be scared. If this is something that like you really want, situations like this are really life-changing situations. I know that like mine wasn't really that bad, but like I know there are some people out there who like have worse situations and they only dream of like having like the perfect teeth or like the perfect smile and everything. They do have financing, so if money is an issue, you definitely can finance, and you can work out like 2-year plans, you can work out 1-year plans, 4-year plans, like literally whatever fits your financial situation. That was pretty much my experience. I'm very happy with my results. If you do have any questions like regarding surgery, or if you think I like missed something, definitely leave a comment. You can feel free to like DM me on Instagram. I'll have my Instagram handle like somewhere down here. You can always DM me and like ask me things that like I maybe didn't cover. You guys can do the same too. If I help at least like 1 or 2 people out there and like going forward with this procedure, that makes me feel good. So like I said, if you have any questions, feel free to leave them or DM me, and I will see you guys in my next video. Thank you for watching, and even if you guys stuck around for like this long to hear me even saying this right now, thank you so much. You don't know how much that means to me. I'm literally just here to like help out, and that's pretty much it. So yeah, I will see you guys in my next video. Don't forget to subscribe and like this video, and I'll see you guys later. Bye.